that.
Luciana.
Thank you. Just on this very specific question about this providers of warehouse space for stockpiling. I asked a parliamentary question which was answered on the 31st of October, and the response was that you've launched this invitation to tender to the providers of the warehouse space to bid for government funding to cover the costs that the providers of warehouse space would incur by providing additional storage space for the stockpiled medicines. It's a technical point, but forgive me, in response to the answers that you gave to the chair of this committee, I don't understand how you're going to hold everyone to account to ensure that you've got the medicines that we might need in the eventuality of a no-deal Brexit.
How do you mean?
Well, the tender's gone to the providers of the warehouse space.
Yeah.
So how are you coordinating with the providers of warehouse space and with the pharmaceutical companies
Right,
to ensure that the
we-
medicines that we need in this country?
We talked to both.
Right.
And there were two issues there. Is there the physical capacity of warehousing to do this? And that's what we are dealing with. And we've already done some on the NHS supply chain for consumables, and we're doing, as you say, the tender on pharmaceuticals. And that's about the total capacity of the system. And then there's individual organisations using that capacity, and those are the company-by-company discussions that the Secretary of State discussed earlier. So there's two separate questions there. Now, of course, what we don't want to do, and underpins all this, as I said, lots of companies, including pharmaceutical companies, are stockpiling already. And, of course, we're not going to meet the costs of people for what they have already done or would do in the normal course of their business. That's why we split it into the two. Is there the capacity? And then a company-by-company discussion about what support the pharma companies need to make use of that capacity.
And then, just to be clear, as I said earlier, the response to the invitation to tender, which we'll be deciding on very soon, shows that that capacity is available because we went to market with an invitation to tender and people have come back and bid in to be able to provide that